During this presentation, we will be discussing radiotherapy for gynaecological cancer, including treatment to the cervix, endometrium, vagina and vulva. It contains the same information as written in the printed booklet titled Radiotherapy to the Pelvis for Gynaecological Cancers, which your oncologist may have given to you in clinic. Radiotherapy uses high-energy X-rays which are targeted precisely to cancerous cells in the pelvis or lymph nodes, or areas where there is a higher risk of recurrence. Unlike normal cells, cancerous cells are less able to repair the damage caused to them by the radiation. This female anatomy diagram may help you to understand where the area to be treated is situated within the pelvis. All of the female organs sit very close to the bladder and the rectum. This slide shows the radiotherapy pathway, starting with an initial planning appointment which includes a CT scan. This will be discussed more in a moment. The next step will be the start of the radiotherapy treatment itself. This is a daily appointment, usually Monday through to Friday, with weekends off. Whilst on treatment, you will meet weekly with the review radiographer for a chat about how you are feeling during the treatment and whether you are experiencing any side effects. After the course of treatment has been completed, you will have a follow-up appointment with your oncologist at around 6 weeks after the radiotherapy has finished. Now we are going to describe what happens when you come for your radiotherapy planning appointment. Your radiotherapy treatment planning appointment will involve you having a CT scan. We ask that you arrive about 1 hour before the scan appointment, as there is some preparation we will ask you to do. We would like you to have emptied your bowels on the day of your CT scan at some point before your scan appointment, but it is not necessary to try to empty your bowels just before the scan. We do, however, want to scan you with a comfortably full bladder. In order to prepare for this, one of the radiographers will come and meet with you, show you to the nearest toilet and ask you to empty your bladder. We will then ask you to quickly drink 3 cups of water whilst we explain to you what the CT scan involves. We will wait for 20 minutes after you have finished drinking the water before we take you in for your scan. This is to allow enough time for your bladder to fill with the water. If you are receiving radiotherapy treatment to your cervix, you may have 2 radiotherapy planning CT scans, one with a comfortably full bladder and one with an empty bladder. You will be asked to remove all of your clothes from the waist down and put on a gown. If you are also having your abdominal lymph nodes treated, you will also be asked to remove your top half of clothing. You may prefer to bring your own dressing gown from home. Please breathe normally and keep still throughout the planning appointment. It is important that you are completely relaxed during your scan to ensure your position can be reproduced daily for treatment. The radiographers will need to see your pelvis area, but we endeavour to maintain your privacy and dignity as much as it is possible. They will need to manoeuvre you into the correct position, and it is helpful if you can relax and let them move you. A few measurements will be taken and small marks will be drawn on the centre and sides of your pelvis. You can breathe normally during the scan and there is no need to hold your breath. You will be asked to keep as still as possible, and the scan itself takes around 5 minutes. The radiographers will be outside of the room for the duration of the scan, but if you need them at all, just raise your hand and they will come in to you. You will not feel anything during the scan, but you will feel the couch move slowly. Once the scan is finished, the radiographers will come back into the room. They will need to make some tiny tattoo marks at a point of reference on your pelvis and occasionally on your chest. There will be 3 or 4 permanent tattoos about the size of a full stop or freckle. Sometimes the doctor requests that an injection of contrast is given before the scan takes place. Contrast is a type of dye. If you have ever had an allergic reaction to a contrast injection before, you must tell the radiographers beforehand. The injection involves having a cannula, which is a thin flexible tube inserted into your arm or hand using a needle. The contrast is injected via the cannula. The cannula is then removed 30 minutes after the CT scan has finished. You may experience a metallic taste in the back of your throat or a warm sensation, which is often concentrated in the pelvic region, during and after the injection for about 20 seconds. If you start to feel unwell, raise your hand immediately so the radiographers can stop the injection and come into the room to check you're okay. Once your CT scan has finished and the tattoos have been done, you'll be free to go home unless you have had a cannula inserted, in which case this will be removed first. You will be given the date of your first treatment appointment, and this is usually for around 2 to 3 weeks after your CT scan. During this time, your oncologist will be using your scan to decide exactly where the radiotherapy needs to be given and a treatment plan, which is individual to you alone and will be developed and checked within the physics team. Your CT scan is for planning the treatment only. You will not receive any results from this scan. No treatment plans will be the same. They are planned to the individual using their CT planning scan. This slide shows an example of a radiotherapy treatment plan. This slide shows another example of a radiotherapy treatment plan to the lymph nodes in the pelvis. The next few slides will talk about the radiotherapy treatment itself. On your first day of radiotherapy treatment, we ask you to arrive 1 hour before your appointment time. Please follow the royal blue coloured signage, which will direct you to the radiotherapy reception desk in the main waiting room, and then report in to the radiotherapy receptionist, who will show you where to wait. One of the radiographers will come and speak to you to explain the treatment process and answer any questions you may have. They will also provide you with a list of the first week's appointment times. The remaining appointment dates and times will be given to you weekly on a Friday. Once the treatment has been explained to you, you will be asked to empty your bladder in the nearby toilet and then to drink 3 cups of water. We will wait 30 minutes once you have finished the water before we call you into the treatment room. This is to ensure you have a comfortably full bladder for radiotherapy. This photograph shows the door to the radiotherapy waiting room and reception desk in Reading. There is also a waiting room and reception desk in the radiotherapy department in the Bracknell Health Space. One of the radiographers will then come to find you to ask you to change into a gown about 5 minutes before they take you into the treatment room. We provide hospital gowns, but these do not always fit well. You may prefer to bring your own dressing gown from home each day. You will need to remove your lower half of clothing unless advised otherwise. This photograph shows one of the treatment machines called a Linac. You will be called into the treatment room and the radiographers will help you onto the treatment couch. You will be lying in exactly the same position as you were for the CT scan. The radiographers will need to see the tattoo marks and therefore will need to lower or remove your underwear and cover you with paper tissue to maintain your dignity. The radiographers will adjust your position on the couch until they have you in the correct position. You will need to relax as much as possible and let them get you into the right place. You will hear the radiographers call out some numbers and measurements to each other, and you can ignore these. Once they have everything set up correctly, the radiographers will leave the room to switch on the treatment machine from outside. The radiographers will be watching you all the time via the in-room CCTV cameras, and they have an intercom that can be used. If you feel anxious or concerned at any time, raise your hand and they will stop the machine and come into you. The treatment machine will rotate very slowly around you, taking another scan to check your position on the couch. There will be a slight pause once the machine stops moving, whilst the radiographers use the scan picture to check everything is in the correct position. They will then switch the treatment machine back on to deliver the treatment itself, and this will take another 5 minutes to be completed. Some of our treatment Linacs are fitted with a new piece of equipment called Align RT. This is a camera system that is used to detect patient motion during radiotherapy. Align RT will stop the treatment machine if it detects the patient is moving, and it restarts the machine once the patient is back in position. You will not feel anything from the Align RT equipment, but you will notice a dappled red light shining from the cameras. It is safe to keep your eyes open if you wish, however please do let us know if you are light sensitive. The next few slides will help to answer some of the questions our patients often ask us. Radiotherapy is not painful, and you will not feel or see anything during the radiotherapy, but you will hear a buzzing and beeping noise as the treatment is delivered. Radiotherapy does not make you radioactive, and it is perfectly safe for you to interact with others, including babies and children, after treatment. The machine does not move on its own. It is programmed by the radiographers inside and outside of the room. The machine moves around you and gives you treatment from different angles. You may feel anxious that you will be enclosed by the treatment machine, but this will not happen. The machine can move around you, but no machinery will press down on you. Once we have started treatment, we aim to go through it without any breaks or days off. However, we know that circumstances do sometimes arise where either you cannot come for treatment or for technical reasons, such as a machine breakdown, we are not able to deliver your treatment to the original schedule. If any treatments are missed, then they will either be added onto the end of the week or overall treatment course. There may also be some occasions where you receive 2 treatments in one day. We would prefer to avoid gaps in treatment wherever possible. The next few slides will talk about your weekly review whilst on treatment. You will be offered the opportunity to meet with one of the review radiographers each week during your radiotherapy. It offers you the chance to discuss any concerns or worries you may have, and they will give guidance and advice on managing any side effects of the treatment. The next few slides will talk about the most common side effects from radiotherapy given to treat gynaecological cancers. Not everyone will report side effects from treatment. They occur very gradually, and you are more likely to notice them in the second half of your course of treatment. They will peak at the end of the course of treatment and may appear unchanged or get worse for the following 2 weeks. They will then gradually start to subside, and most have settled completely by 6 to 8 weeks after the treatment has finished. Radiotherapy can affect your energy levels, your motivation and emotions, making you feel tired or fatigued. Fatigue is an extreme tiredness. Tiredness can continue after radiotherapy has finished and may last several weeks. We encourage patients to carry on with their daily activities where possible, as there is good evidence that taking regular gentle exercise helps patients to cope better with tiredness. Equally, allow time to rest when your body needs to. Where possible, to help you manage tiredness, try to plan your day in advance and incorporate some regular, gentle exercise. If you are still working, you might consider working from home or altering your working hours. Consider trying the complementary therapies offered at the hospital, such as mindfulness, aromatherapy and massage. If you are interested in these complementary therapies, ask the review radiographer for more information about this when you start your treatment. It is also helpful to eat a balanced diet and aim to drink plenty of fluids, around 2 litres per day, which is the equivalent of about 4 to 5 pints. Your skin may become dry, tender and pinker in colour, similar to a mild sunburn. In some cases, the skin may blister and break. If this happens, the radiographers will advise you to discontinue applying any cream, keep the skin clean and dry, and ask for further advice. Review radiographers can provide dressings or topical gel to soothe broken or blistered skin. In order to help look after your skin during radiotherapy treatment, we advise you use a moisturiser that does not contain sodium lauryl sulfate. This should be used at least twice daily. This should, however, be stopped if the skin becomes broken or blistered. We also advise avoiding shaving or hair removal on the affected area. Using a mild, unperfumed soap with tepid water in the shower and patting the area dry when getting out of the shower, therefore avoiding rubbing or scratching, will help prevent the skin becoming dry and itchy. It is also important to avoid applying hot or cold sources to the treatment area, such as a hot water bottle. Wearing soft cotton, loose clothing will also help protect the skin by avoiding any unnecessary friction. The treatment area should be shielded from direct sun exposure, and use of a high factor sun cream is recommended for 1 year once your radiotherapy treatment is complete. If your skin becomes broken or blistered, you may experience some pain or discomfort. You are able to take painkillers such as paracetamol following the dosage instructions on the packaging. If the pain is not managed, please discuss this with your review radiographer, who can then liaise with your doctor. Radiotherapy for gynaecological cancer can cause irritation to the sensitive lining of the bladder. You may notice that you need to urinate more frequently and with a greater urgency. You may find that you get a mild burning or stinging sensation when you urinate, and you may find that the flow is not as good. Please let the radiographers know if you are having problems passing urine. Drinking plenty of fluids is the best way to reduce discomfort when you urinate. Water is best, and we advise our patients to keep tea and coffee intake to a minimum whilst having their radiotherapy. Lemon barley water and cranberry juice can help to reduce burning and stinging pain, but those taking blood thinning medication called warfarin should not drink cranberry juice. The radiotherapy may also affect your bowel habit. You may find that you open your bowels more frequently than usual and that the stools are smaller in size and shape. You may find that your bowels become a bit looser, and we will advise you what to do if this happens. The radiotherapy may also cause temporary mucus discharge and discomfort in the back passage, and even occasionally some mild bleeding. Please do not become anxious if you notice these things. The review radiographer will discuss any side effects that you experience and will suggest how best to manage them. Also remember that in most cases these side effects are temporary and will generally settle down a few weeks after the treatment has finished. Some patients do find that certain foods will continue to irritate their bowel even once treatment has finished. Therefore, it can be useful to keep a food diary to identify any foods that may be causing the irritation. During the course of radiotherapy, you may occasionally feel sick, or you may notice your taste changes and you go off your food. These symptoms are more common for individuals receiving chemotherapy. If you are struggling in this area, please let the radiographers, nurses or doctors looking after you know, as they can suggest things that may improve your symptoms. This treatment causes infertility, which is permanent and is very likely to bring forward the menopause 3 to 4 months after treatment. Your consultant may recommend hormone replacement therapy if your symptoms are troublesome. If fertility is an issue for you and your partner, please let your consultant know so that it can be discussed further with you. Early and late effects of treatment can cause changes to the vagina. These include vaginal scarring, known as fibrosis, and shortening and tightening of the vaginal space, called stenosis. In a worst-case scenario, the walls of the vagina may stick together, known as adhesions. To prevent these occurring, you will be advised on the use of vaginal dilators by the review radiographers. An information sheet about this will also be given to you. Due to the side effects on the vagina, it is important that you do not use any tampons or menstrual cups throughout the course of radiotherapy treatment. During your course of treatment, the top of your vagina becomes very inflamed and you may encounter discomfort during sexual intercourse. It is recommended that you do not have sexual intercourse whilst on treatment and 2 to 4 weeks post-treatment to allow the area to heal. Many women find their vagina is dry at first, therefore use of lubricants such as Replens for day-to-day dryness and/or silk lubricant during sexual intercourse or with the dilator may help. These lubricants can be purchased on prescription or from local pharmacies. Please don't feel embarrassed about asking your healthcare team about any concerns you may have. We are here to help make your journey through treatment as stress-free as possible. Finally, we are going to explain what happens once your radiotherapy has finished. Once your radiotherapy treatment has finished, you will be sent an appointment to see your oncologist around 6 weeks after. We will make sure that you have contact telephone numbers for the review radiographers and your clinical nurse specialist, so that you can get in touch with us if you have any questions or concerns once your treatment has finished. Any further scans required will be discussed with you at your follow-up appointment, but no scans will be booked prior to this appointment. We hope you have found this information helpful. If you have any questions prior to your radiotherapy planning appointment, please do give us a call on 0118 322 7872.